The journal is an online resource for mainly New Zealanders who can use it as a program to help themselves if they're suffering from depression, or they can refer other people to it if they know family members far now. It solves a number of problems, one of which is that people can access it any time. They don't have to just be available for when therapists are available. So it's convenient, it's accessible, people can access it from home, they can access it from other venues as well. And the other problem it probably solves is the demand for therapists for psychological, non-pharmacological therapies. With the best will in the world, no country is going to be able to train enough people to provide or to meet the demand for psychological therapies. So one of the issues is, well, why not have e-therapies if a computer can do something as well as a human can? And it may well be that in the future what we'll be seeing is people as their first step in any care program is getting computerised therapy first, and then it's only if people don't respond to that do they see somebody face to face. As a way of managing a workforce problem or workforce shortages, that may well be the way where we'll be going. And of course people tell people computers more than they tell humans. And the evidence is that people divulge far more to computers than they do face to face. What we don't know is how it's going to do things we haven't even thought of yet. Because at the moment, the way technology is being used in healthcare is to do things we're already doing in other ways. So e-therapies are essentially electronic versions of talking therapies, but we haven't developed any therapies yet which go beyond that, which are just standalone therapies on their own right, which aren't just copies of what we do as a talking therapy. So that's where it's going to go next. We're going to develop therapies which you can only do in e-therapies, using electronic or computerised therapies.